So by the time you get to your 60s and 70s, your feet have done a few kilometres. And today we're talking to our resident podiatrist, Brenton from Hurst Podiatry, and we're going to talk all things feet in regards to aging. So what to look out for your feet as you age and how to help your feet age well. So Brenton, firstly, what happens to your feet as you age?
Well, quite a number of things, actually. So depending on exactly which portion of the feet you're talking about, unfortunately, not a lot of positive things, but they all the different facets of the feet change in their own way. So probably the things I think that people most associate with it are probably toenail changes. We do see toenails typically thicken up, sometimes discolor. They can change shape. They can change the angle that they're on. We can see arthritic changes to bones and joints, so we can lose movement in the joints. They can become stiff and painful at times. The circulation is sort of central to a lot of that and tends to deteriorate a little bit over time as well. And that can result in a number of changes. Some of them are more visible than others. So you can see the color change potentially to like a whiter sort of color, or even like a reddy blue if they're really deficient in blood down to the feet. And the skin can change as well. So because the skin gets its nourishment and its nutrients and things from the blood, if that's sort of declining, then the actual skin can thin. It can get very papery looking, almost transparent in some cases, which makes us more vulnerable to ulcers and wounds and things like that. So not a lot of good news in there in terms of the things that do happen with it, but it is a multifactorial thing when he changes a number of different elements of the feet.
So maybe you can dispel a bit of a myth and do it's myth or true that your feet are that your feet are a mirror of your health, that you can find symptoms, as warning signs of other health things with things that go wrong with your feet as you age. What are your thoughts on that?
Yeah, so that is true to some extent. And it depends on what body part you're talking about, but heart disease can be reflected in, sorry, I just got a message. Heart disease can be reflected in feet. So you can see swelling. As I mentioned before, the skin can atrophy and thin, can even look almost transparent at times as a result of the blood flow. Kidney disease can be reflected, believe it or not, in feet as well, because kidneys have a big impact on how much fluid we do and don't retain. You can see swelling in the feet as a result of kidney disease. And a whole bunch of other different pathologies can show up in various ways in the feet. It was actually interesting when COVID was starting up early doors. There was a theory that there was a certain type of rash that went along with COVID, and they were encouraging podiatrists at one stage there to watch out for this particular type of rash. So it's amazing systemically, even skin pathologies that become more common as we get older, things like eczema and that tend to we have them all through our lifetime, but they tend to flare worse as we get older, as our body doesn't regulate itself quite as well. All these things can show up in the feet, sometimes exclusively or sometimes broadly across the whole body. So yeah, I would argue that it is true to
So you pretty much don't ignore your feet if there's swelling or something going on. So
it may not be something horrible. You might not be seriously unwell or anything, but it can be an indication. So it's like a lot of things, isn't it? Ignore it at your peril. You're better off getting in.
Yeah, absolutely. And maybe one more sort of myth to dispel: is it true that your shoe size changes as you age?
So I reckon true also in a number of cases, believe it or not. So it actually makes a little bit of sense. If you think of the arch of a foot and how a triangle works.
Yeah.
So generally, as we get older, we lose a little bit of our ligament quality and the actual arch physically drops. So we tend to get a slightly progressively flatter foot. So if you started with a gun barrel flat foot to begin with, chances are that foot's not getting much longer. But if you had a bit of an arch and you start to lose that over a lifetime, the triangle becomes flatter and it becomes longer. I actually read an article a little while back that suggested that we gain half a shoe size every 10 years from I can't remember, I think it was about age 70. So the classic one when it comes into the clinic is your grumpy old man with a sore toe, and he's got a corn on the end of his toe, and he's wearing the wrong size shoes. He's adamant, I've been a size 10 since 1924 or whatever it was. And he was probably right, but his foot's then changed shape and the toe's now hitting the end of the shoe, and he's developing an issue with that. So it does absolutely happen. And I don't know about you, but most of us don't tend to actually get our feet measured when we buy shoes. We just kind of walk in, I'm a size X, whack them on, away we go kind of thing. So it is worth knowing that you do need to get that checked a little bit more frequently when you're sort of in that 60, 70 plus kind of range.
Yeah, absolutely. So I guess while we're talking shoes then, how important, and I'm guessing I can, guess the answer to this, but how important is shoe choice then as you age?
Yeah, critical. So we're often, I like the square plug in a round hole analogy where, the foot is changing shape quite dramatically in some cases. You're more likely the older you are to have hammer toes, claw toes, bunions, tailor's bunions, all these things that make the foot a different shape to what it was in its infancy. And footwear doesn't typically change that much. It's roughly the same shape. And if your foot is no longer the same shape, the odds of it fitting into the shoes well that it did early on in your life isn't that great. So you need to find shoes that are accommodative to that. So you can buy brands like ProPay and Dr. Comfort have portions of shoes that are made out of neoprene, which is the stuff we make wetsuits from, and can be accommodating to some of those joints. You can get shoes that are narrower and wider at different portions as well. It's finding a shoe with the right last, but you do become, sort of becomes the needle in a haystack kind of quandary later on, where your foot's a more unique shape. The volume of shoes that you'll have to choose from that are going to fit nicely for you reduces. So, but it comes more imperative as our blood flow decreases, and we have some of these, more likely to be diabetic in older age. We have some of these other factors getting in. The consequences of getting away with, of getting it wrong is greater, and the odds of getting away are reduced because the body just has, it's like it just gets less tolerant of more the older we get. So, so I would say really, really important.
You touched on it a little bit earlier around nails, and nails are a huge part of foot maintenance, obviously. But as we age, it gets a little bit harder, particularly for some people with other health issues, to reach their feet, to make sure that they do that necessary foot maintenance. Any tips in that regard?
Yeah, I reckon half the people that sit in my chair at the clinic have perfectly fine feet, but simply can't reach them. It's just, So trying to address those things, whatever it is, some are more manageable than others. If you start to lose your vision, you're probably out of luck there. You're going to need some assistance. But doing things like Tai Chi and light exercises and things like that encourage continued range of motion and better mobility, and allow you to access the feet more easily. That's definitely going to help you, because often the nails aren't actually that problematic. It's just that they're simply not getting down there. And it's not a question of like whether you can just touch your toes for half a second. You've got to sit down there and do the job properly for sort of 5+ minutes. So, and the angles aren't great. You're kind of working back on yourself. So, you really do need good range of motion, and it doesn't take much, whether it's a dodgy back or hip or knee, to lose some of that. So continuing to move, doing low grade, low impact exercise that, facilitates good movement is probably the thing that's going to make it the easiest to get down there and do that just general day-to-day maintenance. Beyond that, the nails themselves can actually change. So some people can get down there quite, effectively, but what they're working on is not something they can manage. Maybe the nails are thick because they've had a fungal infection. Maybe they're thick because they've just knocked them around and wear and tear. So getting a good pair of nail clippers, I personally like the ones that look like a little plier, not the little push together ones. I find those have a very sort of curved edge. You're trying to cut a straight line with a curved edge, but it's never really made much sense to me, whereas the little pliers have a straighter nib on them. And you want to get the ones that have the spring in them, have some sort of rebound action. They're articulated. Otherwise, it's really awkward to get through them. And cutting straight across and a little bit at a time. I think the other mistake people make is they're trying to cut this huge nail in like one clip, and you're just not going to do that. So, and the other little trick is just soak them before you use them if they're thick. Sitting them in, tub full of warm water gives you the opportunity to dip a few other little things in there that can help your skin and hydrate things. Just make sure you give them a good dry afterwards. But yeah, cutting them after you've given them a good soak can make doing that task a lot easier as well.
Yeah, a little bit of self-care with a mini foot spa sounds like a good plan, I think.
Like a little mini spa treatment at home.
Sounds good. So if I were to say to you, what would be your number one tip as a podiatrist in terms of taking care of your feet as you age, what would you say?
Yeah, so I'd probably give you a tip that applies beyond just the feet. I think you'd hear this from a lot of the therapists that you speak to, and it's just keep moving. Just don't. The people that I've observed lived the happiest, longest, healthiest lives are the ones that stay active and keep doing things. And that can be whatever it is to you. I mean, there's, as I mentioned, exercise like Tai Chi before, which is fabulous. But if that's not your thing, then find something that is and keep going. I reckon the body's like that old metal gate at a farm. If you don't keep opening and closing it, it rusts up and it seizes up. You got to keep it moving, keep mobile, keep active. It's not just good for your feet, but it's good for your cardiovascular health, keeps the weight off, keeps the metabolism going. There's a lot of talk these days about the value of vitamin D, getting out in the sun and getting a little bit of that on us as well, because we tend to be, it's hard down in cold Melbourne at the moment to do that. So yeah, get moving, get out there and keep doing things that you enjoy that keep you mobile. That'd be my suggestion.
Awesome advice as always. Thank you so much for your time.
Pleasure. Thanks, Wendy.